Studies show prescription drug use among children is growing faster, especially in kids with ADHD and bipolar disorder. Parents are concerned over the effects of diagnosis and the effects of medication. KIMT News 3's Jenna Lee is in Studio 3 now with a Covering Your Health special report.
More parents are looking to doctors for help to explain their child's angry outbursts or lack of attention, focus, and concentration. Is it a mental health issue that's leading to multiple diagnoses and a cocktail of meds? Or could it be something else?
My favorite animals are Siberian tigers, woolly mammoths.
Michael is growing up with plans to become a veterinarian. Austin hopes to rein in the life of a cowboy.
Tail.
Michael and Austin are like any other children. They like to learn, play, and dream big.
Some days I could go without medicine, but some days I can't because I got way too much access energy.
But living out their dreams, doctors say, may be limited.
I can because I have ADHD and that's just...
Yeah. Good job.
The Lenz brothers are diagnosed with attention deficit hyperactivity disorder and autism spectrum disorder.
Yeah, you did.
Their symptoms locked in at ages 5 and 6.
Well, Michael's meds are here. Austin's meds, the Tenex, the Risperidone, and Lexapro.
Powerful antipsychotics to promote calmness and concentration and help complete everyday tasks.
And then his afternoon meds, of course, too.
With a combination of prescription drugs and horse therapy lessons, the boys are learning how to buck the trend for kids with learning disabilities.
I truly want my boys to be able to be off meds, to be able to function.
But that may be difficult. The boys are very quick to metabolize their medications, meaning pills that would typically last 6 to 8 hours are dissolving sometimes in less than 4.
And I think part of his speech has been impacted from it because at the end of the day, all the meds are there still, little traces, and it makes his mind mushy, which tends to make his speech mushy.
What's it like to take medicine every single day? Is there a day where you don't want to be on medicine?
Yep.
The Lenz family spends $1,500 a month to help treat the causes of ADHD and ASD.
No drug is perfect, and nor will it be. And so it's kind of a trial and error thing. You do what works, and you try to combat the symptoms the best you can without trying to get more symptoms of the meds involved. Well, it's in there.
Medications are playing a more serious role in kids' lives than ever before.
In Mason City, we have a higher rate of students identified for special education than the rest of the state of Iowa. For instance, in Mason City, we're at about 19% of our students. The rate for the state of Iowa is 12%.
Nationally, nearly 10% of school-age children have ADHD. Educators say meeting the demands of special needs students is increasingly difficult to afford.
Funding is worked out from the state and also from the federal level. Back in the mid-'70s, when the federal government decided that we should have special education in the schools, and the federal government wanted to respect the idea of states providing education. At the time, they didn't have the money, so they said, well, here you go, states. Here you go, Iowa. You provide this service. We'll give you as much money as we can.
The government committed to paying 40% of the cost to offer special needs services. It's now 2011, decades later, and just under 20% is being provided. The states make up the difference.
It poses a real problem in trying to be a good steward of taxpayers' money and at the same time provide services that kids need.
The path toward understanding mental illness in children is one rarely without controversy.
Educators are not required to do whatever a doctor says. We are required to consider whatever the doctor says we should do.
The rise in the number of child and teen mood disorders in the U.S. is the latest statistic, but some health professionals think medication for kids with ADHD and bipolar points to a bigger problem, diagnosing children with disorders in the first place.
People diagnose based on their own experience with what they see bipolar disorder in children presenting as, and that can be different from professional to professional.
A new study finds the misdiagnosis rate for kids is about 1 in 5.
There's an opportunity for misdiagnosis, particularly when diagnoses have similar symptoms and there's overlap in the symptoms.
According to the Centers for Disease Control, 60 to 90% of children diagnosed with bipolar disorder were first labeled with ADHD.
But it's not necessarily that they think ADHD leads into bipolar. It's not that.
To reduce speculation and system abuse, this mother says taking an active role in your kids' lives is the most effective prescription. Julie admits there is a great deal of challenge in raising 2 kids with special needs.
I get frustrated, I get mad, and sometimes, you question God, why did you do this to me?
But being her kids' best advocate is a greater gift.
The biggest blessing perhaps to me, is watching them grow up, knowing that they are, neat little people, and their reactions to things, it's priceless.
The Lenz family has noted some positive changes in the boy's behavior from horse therapy and prescription medication, but Julie says setting a routine, staying active, limiting sugar intake, and TV time all contribute in treating their symptoms.